So in this video, we're going to be talking about replacing a missing back tooth. And there's really three options that patients have when considering they're going through and replacing a tooth, or maybe even multiple teeth. So the first one we're going to talk about is a bridge. A bridge is basically a series of 3 crowns that lay across 2 teeth in order to replace the missing tooth in the middle. The other one is called an implant, and that is basically an artificial root where the old root used to be. And then the other one is called a partial denture, and this is a removable prosthetic that kind of goes in and out of the mouth. And partial dentures come in different sizes and shapes, made out of different materials that can replace one tooth or multiple teeth on the left side, right side, both sides, front teeth, back teeth. So partial dentures are pretty versatile, but some patients tell me that they're a little clunky and they don't like really wearing them that much. The reason is, why would we want to replace a missing tooth? Because some teeth drift. And here's an example of a patient that came in many years ago, and you can just see that those back teeth just started to slide forward because the missing tooth, or the tooth that's not there anymore, is missing. The other teeth decided to just slide forward, and then the upper teeth, they started to slide down. So those teeth came down. These two teeth started to slide forward. So it really threw off the patient's bite. So if they would have had the tooth replaced right here, none of this would have happened. So that's the reason why we like to replace missing teeth. But let's kind of go over the different options again. I mentioned bridge at the beginning. Let's go over the steps of how that happens. The removal of the tooth or replacement is going to be done by either an oral surgeon, or sometimes we do them here at Cross Timbers Dental. So let's imagine someone broke off a tooth and it can't be saved. Then we're going to have to take the rest of that root out and then let it heal for a couple of months. When they come back, we're going to then prepare the neighboring teeth. When I say prepare, meaning we have to recontour these 2 teeth on the side in order to make room for this bridge. We take an impression, it's sent to the lab. The lab makes the final all porcelain ceramic tooth colored bridge. It's very strong. And then we take off the temporary, put the final one in, and they're done. With the implants, a little bit different process. The root, assuming that there's a root still there, has to come out, and then the bone has to heal. And that takes about 3 to 4 months. After that's done healing, or the bone is kind of filled into that socket, the oral surgeon is going to then place the dental implant, this thing right here. They're actually going to place that down into the jaw where the tooth used to be. After a few more months of the bone grabbing a hold of that implant, it'll be ready to have a crown put on it. So after the surgeon places the implant, and after the tooth comes out, the surgeon places the implant, they'll finally go ahead and say, you're good to go. You'll come back here to Cross Timbers Dental, where we will then take an impression to have the final crown and abutment made that go on top of the implant. And then it takes about a month for that processing. So if you add up all these different time frames, the 3 to 4 months here, and the 1 month there, that comes out to about, let's just say, 9 to 12 months of total time from the time that tooth comes out to the time the final implant crown is put in place. So it's a little bit more of a process compared to the bridge, but it is a very nice option. With the partial denture, similar to the bridge in the fact that the tooth comes out, a couple months of healing, an impression is taken, sent to a lab where they then make the partial denture that we then hand to you about 1 month later. So that takes about 3 months to complete that process. If we're to kind of talk about bridge versus implant, because I find that most patients come in, they're not really interested in the partial denture, but they are interested in having something that stays in place. And with the bridge and the implant, both of those stay in place. So the advantages with the bridge is that it's completed in about 3 months. There's no surgery. It's going to cost a little bit less. Fewer visits, and you have a temporary you get to wear that's in place 24/7. The disadvantage is you have to go reduce, or have the neighboring 2 teeth reduced in order to make this bridge work. So you kind of have to subtract in order to add back. And that's a little more difficult to keep clean because, as you can imagine, you really can't floss between those teeth because they're all put together. And then if decay would start on either one of these 2 teeth, then it compromises the bridge and you would lose the entire bridge. With looking at the implant option, the advantages is you get to isolate the problem to just a single tooth. You don't have to involve the neighboring 2 teeth. It's a little more stable than the bridge in that it's just a single unit. You don't have teeth spread across a couple of other teeth. You're able to floss around it just fine, just like right in here and here, just like you would a normal tooth. And it's going to feel a little bit more natural compared to something else, because you have the ability to floss and chew with it just like you would a natural tooth. The disadvantage is going to take at least 9 months. Sometimes it takes up to 12 months total when you add it all up. You have to wear, if you wish, a removable temporary. Some patients don't choose to wear anything removable during that short amount of time. It's going to cost a little bit more than the bridge. Surgery is required, and the fact that the surgery of placing the implant in place has to be done, and it requires a few more visits. But I can tell you that when I have patients come in during their checkups, I ask them how do they like their bridge or how do they like their implant, and I would say that when it comes to bridges, patients say they're good, they like them. But I ask them how do they like the implant, they say they love it. They think it's great. So I think patient satisfaction is tilted a little bit more towards the implant being better. They're both good, but I think like the implant works out for people better. So anyhow, that is kind of a quick rundown when you have a missing tooth or multiple missing teeth on how you can replace them. Again, it's either going to be a bridge, an implant, or a partial denture. Hopefully this has been helpful. Look forward to seeing you soon. Take care.